There's an HVTU, HIV Vaccine Trials Unit in Rochester. They had some troubles enrolling Black and Latino folks into clinical trials in Rochester. So they came out and they reached out to us and they said, what population can we start to enroll in clinical trials that maybe have not enrolled before or may have limited or no knowledge about vaccine research or clinical research? And so one that we've identified early on was the houseball community. The houseball community is it's an underground subpopulation within the broader LGBT community that competes in a variety of events called balls. It's comprised predominantly by African American and Latino young men who have sex with men and transgender persons. And it's a part of every community in every major metropolitan city in the U.S. I think that there's been a shift in terms of who's at the ball. It was predominantly transgender folks, and then gay men started to get involved, and now it's really large around women. And heterosexual folks are really getting involved, and the categories are really open at this point. If we're going to do a vaccine, there needs to be some participation by a population that's at increased risk for HIV. One of the things that helped us to identify this as the population to respond to is that there had been several new cases of HIV in Rochester among YMSM, and when asked questions about their affiliation, it all linked back to the houseball community. We started to say that there was an absence of targeted HIV prevention and intervention to this community, and there was no intervention that really helped to destigmatize vaccine research. And so the evolution came to what we call VOGUE, the intervention. There are several staff persons, including myself, who are actively a part of the ball community. So we play different roles at different times, where we always have the table kind of set up to do the education. What I do is I take the words to the ball community and say it on the microphone each and every time. It's my commitment.